This Healthy Living Tip is brought to you by the Christ Hospital Health Network.
Vascular disease involves a wide spectrum of diseases, and they involve diseases of the arteries, veins, lymphatics, and also blood disorders that affect the circulatory system as well. There are a significant group of populations in the United States that are at risk for vascular disease. Almost 25 to 30 million patients over age 70 have peripheral arterial disease. Stroke is the third leading cause of death in the United States and is the number one cause of disability. And aortic aneurysm rupture is the 10th most fatal condition in the United States that can cause significant morbidity. The people who are at risk for vascular disease include anybody aged over 50 with a family history or personal history of diabetes mellitus or high blood pressure or high cholesterol or a family history of circulatory problems. Screening is a very simple, non-invasive testing which is essentially painless. It usually involves an ultrasound of the carotid arteries, which are the arteries that supply the brain, and that can lead to stroke prevention. The second part of the screening is an ultrasound test of the abdomen where they look for aneurysms, which are fatal if they rupture. So detecting these early is very important. And lastly, it's the ankle brachial index where we check pressures of the arms and legs and detect any blockages in the arms and legs, and prevention of which can lead to prevention of amputations. Potentially, if it's not treated, this will be a long-term problem, so it's best to be treated early so you can prevent long-term complications from happening. If one is diagnosed with vascular disease, there are several treatment options that are available. Conservative methods such as lifestyle modifications, including exercise therapy and smoking cessation, in addition to medical management of high blood pressure, high cholesterol, and blood sugar control, along with the latest techniques in minimally invasive treatments, including traditional open surgery. Typically, we recommend a vascular screening, and if any of the tests come back positive, then the letter is sent out to the primary care physician and to the patient as well, and a more formal evaluation of these problems can be done in the vascular lab as well. I think for the overall well-being of the whole society, it's very important that we partake in these screening technologies and to identify the disease processes before they become burdensome for the patient and their families. So treating them early leads to a significant improvement in their lifestyle and prevention of complications from occurring. I'm very proud to be associated with the Christ Hospital. I have an excellent team of fellow physicians and ancillary staff that work very closely with us, and we make sure that the patients get the best possible care.
To schedule a vascular screening, call 585-2668.